getting the benefits they're supposed to. They're missing one, two, three, maybe a year or two of checks. So is this you? Is this someone you know? That's what we're going to talk about today. And this is also a live Q&A because there's always exceptions, the exceptions, the exceptions. And it looks like I've already got a bunch of questions here. So I'll get through the places where a lot of people are missing those benefits. And hopefully that's not you, and you're getting everything you're entitled to, everything you're eligible for, everything you paid for. But just to make sure, let's go ahead and go through this, and then I will answer a whole bunch of questions for the rest of the hour. You don't have to stick for the entire hour. A lot of people complain, I'm not watching you for an hour. The topic of the day only takes about 5 or 10 minutes usually to talk about the topic of the day, and then I get into answering people's questions. So there's that. All right. So if you got questions, make sure you type them in the chat. If you're watching this recording, make sure you join us. I do this live 3 o'clock West Coast time, 6 o'clock East Coast time, and pretty much every day. So, okay, so here's some places that people are missing benefits. Particularly now, a lot more people are missing benefits, missing months of benefits because of Social Security staffing. Social Security, even before Doge and Elon Musk came in, Social Security was at a 50-year low in terms of staffing. So this 55,000 or so Social Security employees, over 1,200 offices throughout the country, and the staffing has been going down and down and down. It was the worst in 50 years. And then Elon Musk and Doge came in with their chainsaw and started getting rid of a whole bunch of people. And now customer service is even worse, and it's probably the worst it's been since 1935. And at the same time, you see those little gray bars there. That's y'all. Those are the baby boomers. 76 million people born between 1946 and 1964. So more people need help, and there's less people at the Social Security offices to help you. And that is by design, by politicians who want to destroy Social Security. And first step is to make customer service the worst it possibly can. And they're doing an awesome job there. So beautiful job, guys. All right. So, but the problem is you're being kept from your benefits. So the number one thing is the file online, which they're pushing file online, file online, file online. And in certain circumstances, I recommend it too. But you have to know what you're doing. And so for our topic today is making sure you get all the months. Here's the deal. So let's say you call up Social Security. This is July 2025. You call up Social Security and say, "Hey, I want to file." Nobody picks up the phone. You wait for 3 hours, or you talk to their new AI thing, and you go around in circles and you start yelling at the phone and all the rest of it. But you get nowhere. And then life happens. You get busy. You call them back in a few weeks, and you're finally able to get through, or you go ahead and file online and you're able to get it all done. You just might lost a month of benefits because it's called protective filing. Protective filing. So basically, once you call Social Security, you reach out to them, you call them, you walk into the office, you file a line, you send them a carrier pigeon, whatever, you're protected for that month. And if it takes you, an actual month or 2 months to actually get your claim adjudicated, processed, then you can still get that 2 months back. And that's what's missed a lot of times. So when, me and everybody else in the agency, we used to do, appointments in the office, people sit down on the other side of the desk and said, "Oh, looks like you contacted us a month ago, 2 months ago. You contacted us 2 months ago. What happened?" "Oh, I got sick and I went on vacation," and stuff like that. "Oh, okay, no problem. Do you want to go ahead and start your benefits 2 months ago?" With the realization that anytime you start your benefits early from Social Security, it's almost always reduced. Every month you start your benefits early from Social Security, it's reduced, and unless you're past your full retirement age. Even then, we'll talk about that. But yeah, if you wanted to start your benefits 2 months ago to get those 2 extra checks, then we would say, all right, let's make your MOE, your month of entitlement, back in April or so. Let's get you a couple of checks ahead of the game. But now you're on your own. You're supposed to do everything yourself, file a line, do everything, know everything. And the Social Security employees, because there ain't many of them out there anymore, They really don't have time to ask you those questions. And it's unfortunate. So you have to know. So please subscribe, like, share all this kind of information with all the people you know, all this, because people are missing benefits. And in terms of the phone, if you call up Social Security and you're on that, talking to some stupid AI, or you just don't get through, make a, screenshot the phone that you're on, you called the 800-772-123, you called that number and you just weren't able to get through, or, get your phone bill or whatever the case may be. So some type of proof. It's usually they kind of take your word for it, but some type of proof that, hey, I tried to call y'all 2 months ago, but y'all never picked up the phone, and I, was going to call you the next day, but hey, life happened and I'm busy, and you should have picked up the phone 2 months ago, and I want those 2 months of back pay. So, and that's the same type of situation if you go into the office and, for some reason the guard or something doesn't let you in. The guards are not Social Security employees. Don't ask them questions about Social Security. They're contracted with Federal Protective Services, so they know nothing about Social Security. But if you really, really have to get in there, here's a trick. If it's a really crucial issue, call your politician and say, hey, it's a really crucial issue. I need to be seen. And that immediately becomes a congressional. So you can go in there and just tell the guard, this is a congressional issue and they should let you in. So a little trick there. Anyway, not everybody use it. If it's a crucial issue, then you use it. Because if, just like everything else, if everybody does it, then it's going to be an issue. But if you really, really need your benefits to start immediately because you're going to be losing your Medicare, or you need that money to start, or whatever the case may be, then that's a good way to do it. And I'm coming up with a system here that we're working on, that's going to help all of this. So stay tuned. Another way people don't get the benefits they are eligible for is they wait to get their documentation. So they say, if it's a divorce spouse benefit or something, they say, well, I'll go ahead and order my, marriage certificate and divorce decree and all that kind of stuff. And then when I get it, I'll call Social Security. No. Call Social Security first. Because right now, because of the low staffing and everything, you're not going to get in there for a month or two anyway. So call Social Security, schedule the appointment, because the appointment won't be for a month or two, and then start getting whatever documents you think you need. Maybe you won't even need them. Like a death certificate, usually if the person passed away in the United States, you don't need it. But don't delay. Call, schedule the appointment. It's called protective filing status. You're protecting your filing date. So as soon as you call and reach out to them, you're protected for that month. So if it takes you 2 months to get your divorce decree, you can always go back and get that start the minute you called. Okay. And then if you don't get your documents by that time, your appointment comes up and you're like, oh gosh, I didn't get my documents. Maybe I should delay. Don't delay. Keep your appointment, because hard to get appointments nowadays. Keep your appointment, and then they'll tell you. They'll say, oh, well, you didn't even need that. When your ex filed for benefits, they told us that you were married from this state to this state, and so you don't even need that. So you just wasted a whole bunch of money. But anyway, and this is really, really important when it comes to disability. I see way, way, way too many people losing money and delaying their case for months because they'll say, well, I really need to file for disability. I'm no longer working over the substantial gainful activity, which people file for disability knows what that is. I've got a bunch of videos on all that if you need help on that. I've also got on all of this information. If you're new, we have a website. It's mygovexpert.com, where it has all kinds of information on the retirement benefits, when to start, the application process, working and benefits, taxation, disability, about information about disability, the application process, continuing disability reviews. We've got a bunch of calculators there, information on Medicare, what's the difference between Medicare supplements, Medicare Advantage, and then there's a whole bunch of other things about living overseas, veterans, Medicaid, living on Social Security alone, which is going to be a big one. That's kind of the one we're really expanding on here pretty soon. A lot of people are, the big beautiful bill is going to be a disaster for a lot of people, but I guess politicians consider that a beautiful thing. So we will remember that, won't we? All right. So disability. Don't wait for, oh, I've got a doctor's appointment next month. I'll just go ahead and wait to file for disability. No, 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 no. I call. This is one of the ones I recommend doing it online, the disability. Why? If you're going to file for disability benefits, you can schedule an appointment. If you don't want to do it online, that's fine. Schedule an appointment. It's going to take about a month or two. That's going to delay everything for a month or two. But if they approve you, they'll start when you actually called. But anyway, because Social Security employees, there's so few of them, and they're inundated, they're rushed. And to do a disability application, sometimes it takes 45 minutes, sometimes it takes an hour, sometimes it takes an hour and a half, sometimes it takes longer. But they, in their particular office, they got 400 other people waiting, so they can only take 30 minutes. So that's why I recommend do it online. And watch my videos on doing it online, the tips, tricks, and secrets I give you. But get your medications, get your doctor's names, all that kind of stuff. Sit there, get you a big cup of coffee, and just take your time and fill everything out online perfectly. And don't wait for, oh, I'll get my medical records next month, so I'll go ahead and wait. No, you file it, and then part of that process, you electronically sign, or pen and ink sign what's called the SSA 827, authorization to release medical evidence, and Social Security gets all that documentation at that time. So they get it directly from the doctor, so you don't have to provide anything if you don't want to. So see, way too many people just lose money because of that. And it's like, yeah, you waited 2 months because yeah, no, that's your money, get it. Okay, a couple of other things. The new Social Security Fairness Act, when Congress wrote that, they backdated it to January of 2024, and I'm getting reports that people are only getting 6 months of retroactive pay, back pay. I would fight on that one and say, no, Congress said, if we were eligible for benefits back in 2024, then we should get that back pay. So if you only got 6 months of back pay based on the Social Security Fairness Act, fight it. And how do you do that is through an SSA 561. And on my website again, you just click on more and click on appeals. And this is the first level of an appeal, is SSA 561. So you got different levels. Level 1 is a request for reconsideration, where you just, hey, can you reconsider your response, your decision. Level 2 is administrative law judge. Level 3 is the appeals council, and level 4 is federal court review. So those are the four levels of appeals. And I've even provided the actual form. It's super, super easy to fill out. People ask me all the time, should I get a lawyer? If you want to pay a lawyer $9,000 to fill out this form, which takes you all about 10 minutes, 5 minutes maybe, then hey, more power to you. I don't want to talk bad about lawyers and stuff. So, they're very litigious. So I won't say anything. If you want to hire a lawyer, go for it. But all you have to do is put in your name, your Social Security number, the claim number. If you're filing for survivor benefits or spouse benefits on another person's record, that's that other person. That's your claim number. So, but if it's on your own record, you're the claimant. And the issue being repealed. I became disabled, 6 months earlier. I disagree with this. And it only gives you a few lines there. So if you need some more information, you just fill out, you just preferably typewrite it, particularly if you got terrible penmanship like I do. And that way the people can actually read it. And just put on this one, C attached, if you want to, add another piece of paper there. And just, you're just asking for kind of a case review there. Yeah, the other stuff mostly is, for SSI and Supplemental Security Income, the welfare-based program. And then you just, you sign it. It says it's optional, but you sign it, mailing address, and all that kind of good stuff. Yep, and that is it. Super, super, super easy. Super easy. It takes you all about 5 minutes. So if you want to pay a lawyer $9,000 to do that, then that is your right. But anyway, okay. Another thing I see people missing benefits is when they file for disability or spouse benefits or anything like that, they're forgetting to mention their children. If you have any children under the age of 18 or became disabled before the age of 22, make sure you put that in there because they might be eligible for benefits on your record. I see a lot of people that file for disability and then they tell the Social Security employee that, and the Social Security employee makes a note of it, and then their case is approved 6 months, a year and a half later, and then the kids are dropped. um, they miss it. So make sure if your disability claim is approved and you do have any children under the age of 18 or became disabled before the age of 22, make sure you tell them and says, okay, thanks for the approval. Are you going to call me to take my application for the other kids? Or since I'm already on the phone, let's go ahead and do that now. So, all right. And the last one, I usually do about 5 or 10 minutes, and I think I've done a little bit longer on this one, but this is important information, and I'm trying to talk as fast as I can, is retroactive benefits after your full retirement age. So if you're receiving, if you are going to be starting your benefits after your full retirement age, and those are called delayed retirement credits, every year you wait to collect your benefits after your full retirement age, your benefits go up by 8% every year. So, so that's one thing. And also another thing is if you file after your full retirement age, you're automatically eligible for retroactive pay for 6 months. So if you file at 69 and you want to start your benefits at the month you turn 69, okay, more power to you. But you can also say, you know what, I want to take a vacation. Go ahead and give me 6 months and I'll use that as a vacation. Obviously, it's going to be reduced a little bit. Every month you take your benefits early, it's reduced. Or actually, it's not reduced in this case. You just don't get those 6 months of delayed retirement credits. So, okay, so those are all of them. And I'm sure I've got tons and tons and tons of questions about all of these. And let's go ahead and get into those questions now. As usual, the question part of this is supported by our friends over there at Chapter. So if you need help with all things Medicare, Medicare supplements, Medicare Advantage, make sure you call them up and tell them Ed said hi. Let's see here. I'm 63, young, was married for 32 years, divorced for 10. He is 62. Can I file for divorced spousal benefits without filing for my Social Security? Will the payment be less? If he is still out there alive and kicking, then you have to file for benefits on your own record first. So you file for benefits on your own record first, and then you file for benefits on his record, even if he's not collecting benefits. If he's at least 62 years old, then that's fine. You can go ahead and start benefits on his record, even if he hasn't started, but he has to be at least 62 years old. It's called independently entitled divorced spouse benefits. So a lot of people are missing that one too. So, all right. Robin just signed up for Social Security, had them take out 10% federal tax. Is that enough? Yeah, it really depends on you. What usually people do, you're called about, this is the V-tax, voluntary tax withholding. It's a little form, a little slip W4V. And they just changed the law or regulation about a year ago. Now you can do that over the phone. You used to have to fill out that little form, but now you can do it over the phone. But yeah, it really depends on how much you make. If you make $1 billion this year, then it's probably not going to be enough. If you make a lot less than that, then it might be too much. So, what people usually do is they've asked me that 1 billion times, and I always say that number one, Social Security doesn't provide that type of tax information, and even as a private citizen now, I don't provide that kind of tax information. I never work for the IRS. But here's what you do. You go ahead and leave it at probably 12%, 7, 12, anyway. But you just go ahead and play with it. And when you do your taxes next year, if too much was taken out, then you tweak it down. If not enough, you tweak it up. So that's what most people do. So they just kind of play around with it the first year and see how everything fleshes out, and then they change it. So, Steve, I listened to you quite a bit, and I heard you say many times that you should pop up for disability and retirement at the same time. I live half time abroad. will I need to present for the process? Okay, so Steve is talking about a rib dib. So if you are going to be filing for disability benefits and you're also at least 62 years old, you can actually file for retirement benefits and disability benefits at the same time. Rib dib, retirement insurance benefits, disability insurance benefits. And why? You're not going to get both checks. You're going to get the higher. But because disability claims take forever to get decided, people can't wait forever. They can't wait for 6 months, a year and a half, which is unsatisfactory. That's why we're going to work on, getting our politicians to fix that. So stay tuned. So what people do is they go ahead and file for disability benefits, and at the exact same time, with the same claim specialist at Social Security, they say, let's, so you got my disability and everything like that, but let's go ahead and start my retirement benefits too, because I kind of need to pay the rent. And they'll start your retirement benefits while you're waiting for your disability to be approved. And once your disability is approved, then they will make the calculations and increase your benefits. So will you need to be present for the process? Not necessarily. If they don't have enough documents, then sometimes they will send you to what's called a consultative exam. And if that's the case, then it has to be through a Social Security contracted doctor. And yeah, they're only in the United States that I know of. I've never heard of a consultative exam being done outside the United States, maybe on a military base or something like that. But other than that, not so much. But that's only if you have to do a CE, consultative exam. Patty, what about survivor benefits? Husband passed 3/2014, didn't file until 6/2014 due to waiting for burial with family fighting over my 30 years of marriage facts. Yeah, that type of stuff. If you called and were protected and, waiting for any type of documentation and stuff, here, if you're ever denied on things like that, I had never, well, once in taking hundreds of thousands of claims, I never denied anybody for lack of evidence, except for once. And basically what it is, you file a claim, they said, okay, we need the death certificate, we need the marriage certificate, we need a divorce decree. And what happens is the Social Security employee puts they call it a tickle date, and for 14 days. Okay, after 14 days, it's kind of a tickle that's like, okay, let's go back and see where this documentation is and send another letter. And some Social Security employees get a little rambunctious out there and they go ahead, well, you didn't provide it in 14 or 24, or you didn't provide it, so I'm just going to go ahead and deny the claim. I never did that. People have extenuating circumstances. You just say, hey, okay, I understand. You're going to get it sometime next month. Okay, just you did request it, right? And then you just go ahead and keep it. They get harassed by their supervisors, and everything is based on timeliness metrics. And it's like, okay, you've got a case that's been on your desk for 30 days. What are you doing? And I just said, the person's waiting on the documents. But some are paranoid about that, torquing off their supervisor. So they say, I'll just go ahead and deny it. If they deny it, it's just for lack of evidence. You get the document the following month and you give it to them and they reopen your case, which is more of a nightmare. And so internally it's for the claim specialist here. Yeah. So if they ever deny your case and then you get the documentation, just provide the documentation and they'll reopen the case. So, but in your particular case, my philosophy and all that, if you believe you're right and Social Security made a mistake, then request a reconsideration. And all they can say is no, or leave us alone. So it doesn't hurt to try. I am on SSDI. My full retirement age is 67. If the full retirement age is raised to 69, will my SSDI go until... Yeah, that's something we are going to make sure doesn't happen, right? So we are going to join together and make sure they don't do anything stupid like raise the retirement age. That's fine for people that, like me, just sit here in a desk. But, my father was a long distance truck driver and, just can't do that at 69, 70, some people can, but yeah, manual labor. So hopefully that doesn't happen. But your question is right, Anthony, in the fact that, yes, if you're on disability benefits, when you reach your full retirement age, your disability benefits switch over to regular retirement benefits, and everything stays the same. Check amount stays the same. Direct deposit stays the same. Most people don't even notice the switch. So, Hilda, what if a person gets a lawyer to apply for SSI denial? Grandson is mentally illness. If you can get a lawyer, then yeah, then yep. But remember, lawyers, they're in it, they have to pay the rent and their employees and all the rest of that stuff. SSI, supplemental security income, a lot of lawyers don't like taking those because there's not a lot of back pay there. But yeah, yeah, if a lawyer is willing to take the case, and that's how lawyers, increase their, they can brag about their, oh, if you hire a lawyer, there's a 50% better chance you get your case approved versus people that don't. Well, that's because lawyers pick and choose who they take. It's like, yeah, they always bet on the winning horse because they know, oh, okay, this looks like this case is pretty easy, so I'll take this one, and that way I'll get paid. This one, oh yeah, I don't think you're going to get approved. So yeah, sorry, can't help you. So yeah, if you play the odds like that, you stack the deck, then sure, you get a higher percentage rate. So sorry, lawyers, please don't. Yeah, allegedly. Allegedly, that's what some lawyers do. I just want to say how much I appreciate what you do. Thank you for helping so many people. You are truly a wonderful person. Oh, happy spirit. Well, your name really, yes, you picked the perfect name. And happy spirit, I'm going to be calling on you in about a month once this whole thing is done because we need you to be one of our support team members or Inspire team members because with that attitude, you're exactly what we need. So we needed to volunteer here in about a month once we put everything together. So thank you though. Social Security sent letter. They are now deducting Medicare and I owe 6 months. I can't reach the state. No reason. Okay. Okay. It sounds like because you said you can't reach the state, you were receiving Medicaid and you were part of the Medicare savings program in the sense that Medicaid, the state was paying for your Part B premium, the $185. And now you lost your Medicaid or they downgraded your Medicaid or whatever the case may be. Yeah, that's unfortunate. And that's going to happen a lot. And I'm putting together a program to help, because that's, there's about $1 trillion of cuts in Medicaid. And, they talked about, oh, we're just, the $1 trillion and what, how are we going to get that $1 trillion? Oh, there's, 26-year-olds, in the basement playing PlayStation that should be working. Yeah, that doesn't account for $1 trillion. The big thing is the bureaucratic disenrollment. So there's going to be a lot of people that lose their benefits, even though they're eligible for that Medicaid or food stamps or whatever the case, or the Medicare savings program. They're eligible, they're fully eligible for it, but because of all the hoops they had to jump through, they just didn't jump high enough through a particular hoop, and they lost their Medicaid. They lost their food stamps. So they have to pay $185 now, and they have to, yeah, so that's the trick. The hoops are crazy, but we're going to come together and we're going to help y'all jump over those hoops. So I would reach out to the state and find out, why your Medicaid was denied. If you know why, then that's unfortunate. Unless you won $1 million lottery and that's why they stopped your Medicaid. But anyway, I'm sure you wish that would happen. But if you lost your Medicaid or they downgraded it, then yeah, unfortunately, you have to pay the $185 yourself. But there is another program out there. It's called the Medicare Advantage. I always recommend Medicare supplement plans, but they're not for everybody. If a Medicare Advantage is better for you, then it's better for you. Bella was saying that she has hers for like 4 months and she loves it. So perfect. So everybody is different. But if you, there's Medicare Advantage Part B give back plans. So there might be one in your area. So you can reach out to chapter and say, hey, I just lost my Medicaid. And so now you have a special enrollment period. It sounds like you don't have to wait till October. You can make this change now and say, hey, What are these Medicare Advantage Part B give back plans that pay for part of my Part B? So that's what the give back, they gives you back the money you dole out for the Part B. So see if there's one available in your area. Yes, check it out. You can call Chapter and they're 100% free. They don't charge you anything. Medicaid automatic renewals being stopped. Not sure which state or nationwide. Automatic renewals. Yeah, now it's manual renewals. Now everything, and one of the things that the big beautiful bill did is there was a law that was going into effect to make it easier for people to renew and everything like that, make it to where civil servants, people who serve this public, can help you more. And the big beautiful bill decided that's not beautiful. And so they decided it's beautiful to, yeah, just throw you out there to the wolves. If someone who's worked hard and is in their 50s, married to a disabled man, and she suddenly is in a bad way, diagnosed with congestive heart disease and on full-time oxygen, get disability. If you wouldn't be able to get benefits on his record, but if you would only be able to get benefits on your own record. So there are two types of disability benefits. There's SSI and then SSDI. SSI is Supplemental Security Income, low resources, welfare needs-based program. SSDI is Social Security Disability Insurance. That's based on your work record, whether you paid into Social Security and whether you paid recently, 5 out of the last 10 years. So yeah, if you're unable to work because of a disability, file. Don't wait. I mean, it's July, the middle of July here. Don't sit around and wait for August, because then you'll miss July's payment if you're eventually approved. So how can I get to silver here? On YouTube, using a tablet with no visible tabs. Other viewers do this. I want to help too, so I will appreciate any help. Dr. Ed is best friend. Social Security's best friend. Oh, how do I get to silver? Oh, so a supporter, yes. So I think, I'm not sure how, you go onto the YouTube channel and you become, you subscribe. That obviously, I'm sure you're subscribed, please. And then there's also a way you can become a member there. And then, or you can just go to, if you want to support all the stuff we're doing here, all the free calculators and all that kind of good stuff, you can just go into my Social Security, let me take this out, my Social Security or mygovexpert.com, and then go down to, you can subscribe to the newsletter, and then also donate, and you can, throw a couple of bucks, and you can do it there too. I appreciate it. You're too awesome. Thank you very much. I am 70 on a Medicare Advantage Plus plan and Medicaid. I am cashing a culinary retirement money lump sum approximately $28,000 and monthly $265. Will I lose my Medicaid when I receive my lump? Possibly, but there's things called spin down, and it really depends on your particular state. Some state, they don't take resources into account necessarily. So I would reach out to your state and just ask the Medicaid office in your state. That's one of the things we're going to be doing here pretty soon, in about a month or so, is helping you with that type of stuff in your particular state. But so if your state doesn't have a resource limit, then it's not an issue. If it does, most states do have a resource limit. But if you're cashing it out because you need to do something, car repairs or, home repairs or something like that, and you spend it down within a certain amount of time, then it's usually not an issue and they don't count it against you. So. Fast Eddie, Ed, what do you think of this? Raise Social Security to 7% for both sides, no cap. Raise age to 68 in 20 years, 69 to 40. All federal take 10%, and all federal work take 10% cut in pay. Yeah, Social Security is a 6.2%. Raise it up to 7. Yeah, but the big one is the no cap on people that make over 176,000 pay everything like we do. So yeah, and my fellow federal workers would say no on the 10% cut, but yeah, I mean, stuff has to be done. So, Robert, and what if they go through the case and find out that you should get less? You know what I mean? If anything is possible. Right now, I'm getting 1710. What if I end up getting 1500? Then I'm screwed. Okay, so Robert, good. Thank you for that. I think I forgot to mention that as part of my thing about reconsideration when it comes to disability claims. In terms of your benefit amount, no, that your benefit amount is your benefit amount. It's based on your primary insurance amount. So unless, someone was working under your record and you didn't notify Social Security that, somebody what, then yeah, that's the amount is not going to be affected. So that's not an issue. But I do always caution people when they file for disability benefits and they get approved, and disability says they decide and they say, okay, we have found you disabled effective 6 months ago, and so we're going to go ahead and get you your benefits and pay your benefit amount. And the amount, yeah, that's not an issue, because again, it's based on how much you actually paid in Social Security. But if you get some people to say, okay, you said I was disabled 6 months ago. No, I disagree. I was disabled a year ago. Number one, there's a waiting period before you get benefits. Everybody has to do that 5-month waiting period. But if you say, no, I was disabled a year ago and I want to fight that and get that extra 6 months, then yes, then you have to file reconsideration, and an entirely different employee looks at this. And if they decide, the first employee is like, why did you even approve this person? This person should have never been approved at all. What do you mean 6 months? Yeah, person should never been approved. That's the chance you're taking. So yeah, pretty much everybody I told that, it's like, hey, you got the money, you started your benefits, you fought, and do you really want to take a chance of getting 2 or 3 or 4 or 5 more months of benefits, or having them completely deny you? And every now and then people say, oh, I'm going to go ahead and take the chance, and they take it. And yeah, I never heard back for them either way. So stroke was 2012. Many weird setbacks, including after hiring an attorney. Applied with help from a college daughter. Denied. Others stepped in to assist with application. Never completed. More glitches. Yeah, we're coming up with a system for that. So we're gonna have what was her name? Happy. Yeah. So yeah. Yeah, that's some of these attorneys. Again, I don't want to talk bad about attorneys, but the national attorneys, they're kind of clearing houses and stuff. So if you're going to hire an attorney, always hire someone locally that does Social Security disability, because they know the local doctors, they know the local judges, the Social Security judges and stuff like that. So always find somebody local if you're going to use a lawyer. And on your case, Lori, yeah, if you ever are approved, if you want to file again, you say, hey, I went through this thing, however many years back. And on that one right there, it might be tough because they'll say, well, you didn't follow through or whatever the case may be. So they might say the issue was closed out is what they call it. So they might not be able to do it. Or there's res judicata, and there's, admin finality and stuff. So, but file and let them figure out the legal, so file if you want to file. Susan, I am 69 and my spouse is on disability and 58. Do we get full deduction? I'm not sure what you mean by full deduction. Are you talking about the big beautiful bill, the deduction, the tax deduction, that $6,000 or $12,000? That's the only. Yeah, if you do in fact pay taxes on Social Security, then it will help you. But 50% of people, don't even pay taxes on Social Security, so that deduction is not going to help them. So, Donnie, I've been on disability for 15 years or more, and now I'm 65. Do I apply for retirement now? Okay, Donnie, hold that thought. I have a video question that somebody sent in. Where is it? I think I downloaded it. I guess I didn't download it. Okay. Anyway, so I had a video question that somebody sent in. It's basically this is to that person that sent in the video question, and they're asking essentially the same exact question. And they say, okay, I'm disability and I am going to be 62, 63, 64. And should I go ahead and switch over to retirement benefits? And my answer is always, sure. If you want less money, go for it. Because the thing is, if you're on disability benefits and you think, well, I'm on disability benefits and now I can actually start, retirement, you think you're going to get those both checks. No, you're not going to get both checks. If you, in order to start getting retirement benefits before your full retirement age, you're on disability. So if you want to start getting your retirement benefits at 62, 63, 64, 65, before your full retirement age, you'll have to cancel your disability. Cancel your disability and say, I'm no longer disabled. I want to go ahead and switch to regular retirement benefits. And then you might also lose your Medicare because you're no longer on disability benefits. Unless you can get Medicare based on being 65. But yeah, if you want less benefits, then yeah, go for it. If you start your benefits at 62, that means, look at your disability check right now and subtract 30% from it and subtract Medicare from it and go for it. Yeah, nobody does that. Well, sometimes people do that, very, very, very few. 0.001% because they don't want to be on disability anymore for whatever stigma they think it is, or they want to be able to work a little bit more and they don't want to do the CDRs and stuff like that, and they don't mind taking a cut, reduced benefit. But remember, once you hit your full retirement age, then your disability benefits are switched to regular retirement benefits anyway. So there's and at that time, there's no more continued disability reviews. Your benefit amount doesn't change or anything. So sadly, the number of older adults experiencing homelessness is estimated to nearly triple by 2030, but the billionaires will get their big tax break. Yes. But the consolation is on this big, beautiful bill, and hopefully this makes you feel better. Yeah, they get a big tax break for private airplanes, and yeah, they're be able to buy that 8th house they really wanted to stay in that one day a year. So that's consolation for all of the cuts in Medicaid, and they just announced that the Affordable Care Act prices for premiums for that are going to go up to 75%. So yeah, but you get a tax break on your private jet. So there's that. I want to request a reconsideration on survivor benefits. Do I check the case review box in the middle of the form, SSA 561? Yeah, you just put the case review on there. The other stuff is for SSI types. Yeah, that's the new form. The previous form was a lot easier to understand. It didn't have all that garbage in the middle. I like the previous form, but you actually use the previous form if you want. It's more, but yeah, just put case review. That's fine. Yeah, 99.9% of the time people do those. It's a case review. It's not the other two options. So, Bluebird, is it better to start Social Security and Medicare following a lower or higher income year? Doesn't matter. Doesn't matter. Zero difference. Social Security decides your benefit amount by your high 35 years of earnings, and the previous year is the previous year. It doesn't matter. Whatever it was, it was. Unless we were talking about IRMA, income-related monthly adjustment amount, which is a higher premium high-wage earners pay for Part B. So, but that's based on 2 years prior. And so, yeah. Reading with Grandma Ed, when do you relax? In a couple of days. I'm actually going to take about, 3 days off. So you're going to have to do without me for 3 days. And everybody's saying, yay, good. Doing it without me. So yeah, my wife said I have to take off for a few days. So that's what I'm doing. What is the likelihood of passing a CDR review, a continuing disability review? It really depends on a lot of factors. But again, I've got all of that in my website, mygovexpert.com. You click on the little disability thing there, and you go down to continuing reviews. You click on that one, and it has tons of answers, questions and answers on, the continuing disability review process. So my philosophy on continuing disability reviews is FCF. Forget about it until you actually get it, because you might not even get it, even if it's your time, because it's a budget issue. C, copy, complete it and copy, make copies, and then send it in, and then forget about it again. Because even if you send it in, they might not do anything about it. So, pick out. Miss seems busy all the time. Yes, I love being busy. Yeah, and yeah, I'm doing 18 hours a day working on this new project, but it's awesome. I think this is my, as the Japanese say, this is my ikigai. All of my decades are going to be put into this next project. So, if my birthday is 1960, when is my full retirement year? So I have a free calculator for that. Click on the retirement thing, go down understanding benefits, calculate your full retirement year. So let's say it's February, your date of birth is February. Let's make your Valentine's Day. 1960, you said, right? And you click on there and it says your full retirement age is 67. When is that? That is March of 2027. That's your full retirement age. So, oh, there it is right there. So, yep, easy, easy, easy. I'm on SSDI. I get 485 on my ex-husband. I know that's not 100%. Will I get 100% when I turn 65 or 63? If you're getting SSDI on an ex-husband, so that's disabled widow's benefits. So that is your ex passed away, and you started benefits between the age of 50 and 59. So you're getting essentially about 71.5% of that person's benefit amount. And no, if you continue, it won't increase when you turn 65 or 63 or whatever the case may be. You might be able to file for benefits on your own record right now if you're receiving benefits on his record. And that's the only way you can receive benefits on another person's record as a disabled widow. In that case, unless you're a child, but you said there's a husband. So the only way, that has to be a disabled widow. You can file for benefits on your own record, retirement benefits at that time. So other than that, nothing else. But if your benefit is that low, you should definitely check out SSI, Supplemental Security Income, the welfare-based benefit, and that pays up to what, $967 this year. $967. Do they index before they pick the top 35 or after? No, they pick the top 35 years and they find out what the top 35 is, and they index those years for a wage index, and then that comes up with your AMI, the average index monthly earnings, and then they multiply that by bin points, 90%, 32%, 15%. So, but yes, they pick the 35 before they index it. I mean, it's the same. They do it the same. Yeah, the computer does it all. They index all your earnings and then pick the 35 so it's 6 and 1, half does the other. So inlays, member, thank you. While appealing for SSI, and a person is better off with a free legal aid organizations than an attorney. Many nonprofit legal aid groups offer free or low cost assistance for SSI appeals, especially for low income. Yes. I got that on my video I did on living on Social Security alone. I go through about 50 different programs like that. Legal aid centers, the Bar Association, try to find someone in your area that does, pro bono work. If you have a law school at your university, go there, and they have like legal clinics there and stuff. So yes, inlays, please take a note of that. And as part of our new project there, we're going to need that information. So that's the trick. Thank you so much for the information you share with everyone. You are very, very welcome. Thank you. Tangible hope. If you qualified for the one-time lump sum survivor benefit, does that mean you will also qualify to receive the descendants SSA benefits when you reach 60? Not necessarily. Well, yeah, because you're talking about that that awesome $255 lump sum death payment. So you were entitled to that. So that means you were married to the person when they passed away. Yeah, when you're 60, I was thinking about 62, but yeah, when you're 60, I guess if you're no longer married, if you decide to remarry, then before you turn 60, then no. But if you don't, then yes. So I guess anyway. Um, so you can collect survivor benefits. So that means you were married to the person, you were married to him for at least 9 months. There's a couple of exceptions there. And if you're no longer married at 60, then yeah, you can start benefits on that person's record. Um, if you started at 62, you can, then at that time, that's when you need to check out whether you should file for survivor benefits or benefits on your own record, or file for survivor benefits and then wait to collect your benefits on your own record later, or collect benefits on your own record and wait to collect survivor benefits later. So there's a couple of options in there. And yeah, a lot of people don't realize that's another thing. A lot of people miss money, not only in the months, they're missing months, but they're also starting the wrong benefits. So that's one of the reasons we are here talking about this on a daily basis, hoping to get the information out there to more and more and more people. And the only way we can do it is y'all press like and subscribe and share and all that good stuff. William, it's been 7 months, still haven't got my back pay. They have my bank info, and what do you think? It's time to reach out to your politicians. Make it a congressional. 7 months is way, way, way too long. So if you're entitled to those 7 months, reach out to one of your two senators or both of them, your House representative, and they have on their website, they have a little button that says, I need help with a federal agency. If you want to go there, or you can call them up and say, hey, what's going on? Number one, here's my case. Here's what I need help with. Number two, why do I even have to call to do this? Why aren't you supporting Social Security, providing them resources, computer resources and human resources so they can do their job? And it depends who you talk to. They'll give you some BS and they're like, yeah, I'm with you, but yeah. I'm going through a CDR review. What is the likelihood that I will pass it? Yeah, I'm sorry, I don't know your situation. So if you're disabled, then you should be good. And if they deny it, you have appeal rights. So fill it out to the best of your ability. Check out my website, and it might have answers to a bunch of your questions. And make copies and then return it. And then forget about it once you return it, because even if you return it, they might not take action because they don't have a budget. So, all right, let me see if I can find someone that I haven't seen here before. Get some new Angela, if your husband is on disability, put your home in his name to lock into the current tax rate. Okay, yeah, I don't do taxes. Jonica, Dr. Weir, can you briefly describe the death certificate as it relates to reporting to Social Security? Yeah, for people that passed in the United States, it's all automatic. Coroner's offices, funeral homes, they notify the state. The state notifies Social Security Administration. The Social Security Administration notifies the Department of Treasury, and they, stop the payments or suck out that last check if the person wasn't eligible for it. If they were passed away overseas, then that's where this whole yearly reporting type thing comes in. But yeah, most times don't even need it. It's automatic. So lots of ads in the mail now about Medicare help. I need help. I will use Chapter. Yes. Yeah. And that's why my son and I chose them. We didn't want to get into that whole thing, but there were so many bad actors out there harassing people and giving them wrong information and, pushing them towards things they, can't afford and don't need. So we decided to partner up, and Chapter's done a phenomenal job. Yeah, a phenomenal job. My disability benefits converted to Social Security after 5 years. I called Social Security and now receive same amount, and Medicare, I'm 59. Yeah, that does. If you're 59, yeah, that doesn't make sense. Your disability benefits converted to Social Security. Yeah, I don't see that. It converts to regular Social Security retirement. Well, disability benefits, number one, is Social Security. So your Social Security converted to Social Security. Yes, it did. So I guess you're right in that respect. But disability, yeah, Social Security disability insurance is Social Security. It's just the disability part of Social Security. So yeah, that not sure. I pay LEP enroll penalty. I'm going to turn 67 in August. A late enrollment period. Yeah, if you don't apply, if you don't enroll in Medicare Part A and Part B when you're supposed to, 65 or being on disability for 2 years, and you don't have, creditable coverage, that is, let's say you turn 65 and you hear you have to sign up for Medicare. Yes, you do, unless you have creditable coverage. That is, you have health insurance from current work, yours or your spouse's current work, not a retirement plan, not the Affordable Care Act, has to be through current work. And that employer has 20 more employees. But it sounds as though that wasn't you. You just didn't apply at 65. So you're going to have that late enrollment period, which will be 10% for every 12 months you did not sign up. And that'll be 10% for every 12. So it's 2 years. That's 20%. 20% of what? 20% of the $185, whatever it is for that year. So you'll pay 20% extra every year, every month for the rest of your life. And Part D as well, prescription drug plan. You were supposed to apply for that at 65. A lot of people miss this stuff. So, just to be on the safe side, yeah, once you turn 65, a few months before you turn 65, if you're currently receiving Social Security benefits, they sign you up automatically. If you're not, because you want to wait to start your check till later, then you actually have to do it. You have to apply. So, but you have to make sure, you do it correctly. And there's another thing that if you didn't have creditable coverage, you can't sign up for Medicare Part A and Part B until the general enrollment period. And the general enrollment period is January, February, March. So you might not be able to sign up until January. And then they changed the law a few years ago. Before it was if you signed up January, February, March, your benefits, your Medicare wouldn't start until July 1st, which is always a stupid thing. But they finally changed it. And they said, okay, if you sign up in January, it'll start February 1st. If you sign up in February, it'll start March 1st. So Congress actually did something good. So 3 days, that's a lot for Dr. Yeah, yeah, it is. So I think my son's making a video to throw up there during that time. I sent in a review in February for us. Oh, okay. Yeah, I've already did that one. Let's see here. Sherry, I don't recognize Sherry. What's up, Sherry? Are they really going to have no tax on Social Security? No. Yeah. Campaign promise. Psh, nope. I heard that they were taking it out of the big, beautiful, it's out. It wasn't, not even there. Do you think it will happen this year or next? No, it was a campaign promise. And guess what? Politicians make campaign promises and yeah, not so much. So there is one thing, they did a temporary tax deduction of $6,000 if individual, $12,000. So it's basically if you're single and you made $100,000, then the IRS considers you only made $94,000, but you still have to pay taxes on, all the rest of it and your Social Security if you have to pay Social Security taxes on your Social Security. So yeah, no, it did not make it in there. But you got the consolation prize, a little tax deduction that may or may not help you, and a tax deduction for a private jet. Due to the bizarre situations relating to apply for disability, wow, you said a mouthful there, right? Should I make an appointment with one of your experts to assist me in sorting it out? Finally got a face-to-face with Social Security agent complex. The only person I have is my, and that's all the information on our website and all that kind of stuff is free. But that's the only thing that we charge for there. She's got to pay rent too. So if you click on that one on my website, talk to a former Social Security insider, and you will get an appointment with Mai Jackson. She was a technical expert for over 20 years. And yeah, she has appointments available. We just do a limited amount of appointments there. But yep, she can definitely help you out. I used to do these personal appointments, but I just got too busy and stuff. So She was nice enough to do those for me. How much is it? How much is too much in your bank account to qualify for Medicaid? It really depends on the particular state. It depends on the particular state. So, Sunflower Girl. I know I can collect Social Security off my ex benefit, but does he have to be made more than me? It really depends on what type. If we're talking about he's still out there alive and kicking, and you're talking about spouse benefits, then yeah, he has to pay more. His benefit amount has to be twice yours. If you're talking about surviving spouse benefits, no. You can start surviving spouse benefits even if it's lower than yours, if you so choose. And some people do because they want to wait for their own benefits to increase to more. So there's that. All right, let's get one more question on someone I don't. Okay, Jeets. I don't think I've seen Jeets. So this will be the last one. I am in my 50s and disabled due to stenosis. I was sent a short form CDR in February and just received a response saying they don't need to contact my doctor. Does this mean I'm good for a while? Yeah, it sounds like it. Yep. So it sounds like or they don't need to. That means they've got all the evidence they need and they're still moving forward with it, or they're done. Yeah, that's not really clear. But again, if they've got enough evidence, medical evidence to make a decision, then they might still be doing it. Or they might say, oh yeah, no, we ran out of money. We already filled our congressional allotted quota for this month. So yours, we're not going to do anything about. So that's not really clear on what they sent you there. So you might want to reach out to them and say, hey, I want to be able to sleep at night. Are y'all working on this, or did y'all punt and we'll see y'all, 5 years from now? So, yes. All righty. That'll be it for today. I appreciate y'all. And please, 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 please take care of each other. I will be back again tomorrow. Y'all take care. Bye.